Sir, let's kick off with a new, if it's a new pronouncement. Nevertheless, we are still going to be under heightened GCQ at least for the first half of August for now. Are you relieved about this? Is this a good decision for the time being for businesses to reopen, or is this not enough given the numbers that we are seeing of the Delta threat all over the world?
Well, definitely we are relieved because we were posed with the possibility that there will be a hard lock, no? Because of the suggestion of an independent uh, advisor supposed to be Okta, which I don't know why. Now they are very persistent in going against the people they are advising. And last night I was even shocked to hear they're saying that if the DOH does not follow their advice and does not do a hard lock, and the cases go up and there will be more deaths, DOH will have to answer to the people. What kind of advice is that? They're trying to divide the people. They're trying to politicize the issue. If they're just there to help, why don't they advise DOH or IATF and not the media and go public and try to go against the and have their will imposed on the public. They have pushed actually. I'm glad that IATF and the government did not put to the trap because they have been put in this position where damn if you do and damn if you don't. Meaning, if they don't impose a hard lock and something happens, then they will say, "We told you so."
Mm-hmm.
They'll be blamed, and as they said, they will have to answer to the people. But what about them? They're very good in advising and panicking people and advising hard locks. They are not accountable for anything. Are they accountable if people die because of the hard luck? If people get hungry, if there is chaos and there is criminality, they're not. All they're doing it is for business. Because I was really surprised when initially they were saying this is for public service, and then eventually they came out with the presidential uh, ta- uh, uh, and senatorial lineups of who are winning, and all the time there it's a business venture. They have begun to call themselves UP, and then UP does not UP Okta, and I think UP does not recognize them. So who are they, and what is their credential actually? So I don't think we should follow their advice just because they say so. I think the Department of Health, unlike in the last March lockdown that we had,
Mm-hmm.
has been preparing the hospital rooms, the facilities, and unlike then, they know what we're doing. If we have a hard lockdown now, what will we do? Exactly the same what we're doing now. Uh,
Mm-hmm.
Follow the protocols, the vaccination, the contact tracing, the isolation, and then continue improving the numbers of our hospital rooms, our isolation facilities, and that's what we're doing. What would be a hard luck to? It will just cost us billions. Like the ECQ that we did last March, NEDA said it cost the economy for the 2 weeks 80 billion. And they also said that the salary earnings lost to the private sector is about 1.2 billion a day.
Mm-hmm.
And who is accountable for that? And now that we have, hopefully, the DOH has been preparing, the IAT has been preparing our facilities, our hospitals, our isolation, and usage, even oxygens and things like those. If they are, we should see whether there will be a real surge
Sir,
and we can handle it.
Sir, but apart po from Okta, we also did hear from several representatives of the private sector. Now the PCCI has actually retracted their statement that they're recommending a hard lockdown, but we did have even a presidential advisor for entrepreneurship, Joey Concepcion, saying that this might be necessary. Some people saying that, we might need it eventually anyway, and it's better to quell the spread right now than to wait for it to get worse to enable us to, so to speak, save the fourth quarter. What are your thoughts on this? That other business leaders are
Well,
asking for this?
the data that this independent, they started it. That they said it's going to be this and that, and so far they've been doing great because in the past the DOH has basically left them doing all these things using their data, and I don't know who's financing them, but every time they will say this will happen, we will react and we will do a hard lock. Wala naman sila accountability, and the people is facing difficulty. How many people are getting hungry, and how come? How will the and the PCCI was actually misquoted.
Mm-mm.
I think what we were saying is, if there is no choice, give us time. And even Mr. Barcelona said, give us time. Not within the day. You do a change in the you do a hard lock. No, but if there is no choice, then we what can we do?